My name is Donna and I live in Bedford, New Hampshire. The biggest problem before my surgery was not being able to even go out and walk the neighborhood because you're afraid you're going to get out there and get into this pain down the sciatica, down the leg, and feel like you're not going to make it home. And that's not how I wanted to live. No, I'm not living that way, so.
My name's Henry Pallatroni. I'm a neurosurgeon here at Portsmouth Regional Hospital. In general, back pain is a very common entity. Almost everybody is going to have an episode of back pain, or maybe more than one episode. But most people are not going to have anything that's ever going to require significant medical attention. There's going to be a subset of people who don't get better, who do have something more significant, a problem with their discs, a disc herniation, a bulging disc, some type of deformity in their back, something called spondylolisthesis, which is what Mrs. Ferranti had. These are things that are less likely to be managed conservatively. It's not that they can't, and we'd always opt to do that first, but often these are the cases that would be more likely to come to medical attention, need some higher level of care, and may even eventually come to surgery if necessary.
The reason why I chose to have the spinal fusion was because I was suffering just dysfunction in my body for a year and a half. It did get progressively worse. I was tired of altering my lifestyle. I'm a very active person, as well as my work. My line of work is, as I'm a massage therapist, it does tax your body. That was difficult for me too, but I continued working right up until the time of my surgery. And with the pain, I felt varying degrees of pain throughout the day, but usually by 1 o'clock in the afternoon, I would have to lay down. Sometimes I would cry because the pain was so intense.
Here at Portsmouth, we can really do, I would say, 95% of spine surgery, soup to nuts, ranging from very simple things like disc herniations in both the neck and in the low back to more complex things like what Mrs. Ferranti had, where we're going in, we're doing a laminectomy to actually free up the nerves to alleviate her symptoms, but because her bones are offset, that's what the entity of a spondylolisthesis is, if we were to just leave it like that, we would cause that to be much worse, so the bones need to be linked together. So that's what we would do with the rods and screws, and that's the fusion part of it. That's something that requires a whole team, where when we're in the operating room, we're doing that with involvement of radiology to actually put the instrumentation in. Sometimes we're doing neuromonitoring afterwards. It's not a simple surgery where you would just go home the next day. We're going to involve our rehab services. We're going to have one of the local orthotics companies come in and measure her for a brace. Often people will come to see us and they'll say, why should I have this done here with you? Why shouldn't I go down to Boston and have it done? I've seen somebody down there, they have a great reputation, they've written papers, they're doing research on this, et cetera, et cetera, et cetera. And my words to them are always, listen, if you're happy going down there and you're comfortable with that, you should absolutely do that. But from my perspective, this is a small community, we have to take good care of patients. We're not cowboys. We're only going to take care of things that we're comfortable with and that we know we'll do a good job with. And the reality is that you're going to be closer to home. You don't have to drive all the way down there to have the surgery, to have your follow-up. Your family doesn't need to drive all the way down there to have the surgery and have the follow-up. I'm going to be seeing you just about every day. It's going to be me and my very small, intimate team that's going to be taking care of you. When you have a problem after hours and you call, there's not going to be this sort of series of walls to even get to your neurosurgeon. I don't think that you can do any better than you can by having your surgery here and having your care done here at Portsmouth.
I feel Portsmouth Hospital gave me better care than I would have gotten in many hospitals in the area, because I feel like from all the stories that I've heard from people, including my husband who just had his spinal fusion, I just feel like the quality of care that I got here was superior. I have nothing but wonderful things to say about the hospital. I drive by the hospital once a week and I look over and I smile. I smile at the hospital because I feel like it was such a good experience for me. I would highly recommend it to anyone who needs to have this kind of surgery.